As you're aware that most people start getting a lot of itching, irritation and burning eyes immediately after Diwali. Why is that? I'm here to tell you about that. I am Dr. Sudipto Pakrasi, Chairman of the Institute of Ophthalmology in Medanta Hospital in Defense Colony, Delhi. What happens is that during Diwali, there are a lot of pollutants which are released in the environment. These are organic and inorganic compounds which also give sulfur dioxide and other gases in the environment. Not only are these gases very poisonous, they have large particles which go in touch with the cornea and with the tear film, making the tears highly acidic, and with that acidity there is a lot of irritation which starts happening in most eyes. Since our life is completely turned towards screens, all the more reason we need to understand this, because with the pollutants in the environment which are causing the irritation, the fact that we're not blinking often enough due to the fact that we're on screens makes the eye extremely irritable. They become dry. People start talking about foreign body sensations, dust particle feeling of heaviness, being unable to sort of feel fresh in the eyes, being not able to read for a long time. These are things of matter of concern which we unfortunately are not able to address. So one needs to be very careful. First thing which we are taught as youngsters is to keep washing our eyes with water. This should be completely avoided. You should never do that. Simple reason that A, water is not very clean, and number two, because it washes away the little lubrication which is left on the eyes with all the pollutants which are there. The second part is that we should try and remain indoors if possible, especially with some air filtration or some things which are going to purify the air. This will help in reducing the amount of itching, irritation and symptoms. Third, we could probably use some lubricating drops which are effective, which should not contain steroids, which will be able to keep the eyes wet and continue to make the pH, which will not cause irritation. These are simple instructions which you should follow. If the irritation persists beyond a certain amount of time and level of tolerance, please visit your nearest eye care professional so that he or she is able to give you the proper advice after examination.